Hello everyone, welcome to another episode of Health 360. I am Solomon Ebedo.
And I'm Blessing Oduni. Today we'll be speaking to a very important public health issue, which is on sickle cell disease. This disease has actually affected millions of lives.
Truth, it actually does affect millions of lives. And the question is, what is sickle cell disease? Sickle cell disease is a form of disorder that affects the red blood cells, which carry oxygen into the system, and it usually causes severe pain, headache, even organ failures, and is most common among African, Mediterranean, Indian ancestries.
Wow, coming to think about it, despite the advancements in research and technology, we just need to know that it can only be managed.
Yes.
Like we have several individuals that have been down with this disease or diagnosed with SCD, that's sickle cell disease. However, appropriate treatments are given, but we cannot say that there is a total cure, an absolute cure for sickle cell disease, because it is inherited, and over time it can just be managed.
Yeah, and one other thing we need to also pay attention to is the fact that this disease is inherited, and also it's in the gene, and you can inherit it from parents that are healthy. So it's not something that it has to come from people who have certain illness. So in case you're probably wondering if it's the work of village people and all, no, it's not. So it's inherited, it's hereditary, and it only affects a certain group of people.
Wow, so the interesting thing is that we actually have some people that are carriers, and we actually have some people that it's dominant in them. So individuals that are carriers, they have the hemoglobin AS, and individuals that it is dominant in, they have HBSS. So there's a difference between HBAS and HBSS, and it is also important to note that when we keep saying, when individuals everywhere, social media says that know your genotype, you get why. Because imagine an AS coming or getting married to an AS, they automatically produce that HBSS, and it is found in the red blood cell. So what causes, as he said earlier, saying that, so this thing is found in the blood, is found in the gene, and it can affect the red blood cell. So it happens that this is exactly how it happens. That HBS that is found in the red blood cell, the hemoglobin S, makes the red blood cell sickle shaped. So imagine having a red blood cell that is S-shaped. It would affect the flow of blood, and normally red blood cells are round, and then having an S-shaped, it just affects the flow of blood, flow of oxygen, and so many complications begin to happen. So that's how sickle cell comes to play.
And then there are a few symptoms you need to look out for, so that when people with sickle cell anemia, they are exhibiting these symptoms, you need to take them to the hospital. And the severity may be mild, it may be severe, depending on what the trigger is, because a few environmental factors also trigger it, like
the weather. You
have some other triggers, that push the attack. And so when you begin to observe that people are exhibiting, especially those who are known to be sickle cell, that they are exhibiting certain symptoms, like they are running temperature, which can be a sign that they are actually infected, which is something to pay attention to. It's important that you take them to the hospital for medical attention.
Wow, that's profound. And one thing we must note is that individuals around that you would have seen around down with sickle cell disease, they usually have pain crisis. So I'm just picking it up from the symptoms. They have pain crisis. Sometimes you see them, their face is pale, and you're wondering what exactly is happening. It's because they are anemic. So there is obviously the blood doesn't flow well, there's shortage of blood to the important part, and it could lead to acute chest disease complications. And one thing about them is that they also have low immunity. So because they have low immunity, they can easily get infections, and they can easily come down with different diseases, even as far as getting to have stroke, like organ failure, stroke, so many things. So that is why we are here in Health 360 to raise awareness, get individuals educated, and keep sharing the information about sickle cell disease. It is important to note that in Nigeria, I was amazed when I saw from statistics that Nigeria has the highest global burden of sickle cell disease. So it means that out of our population, we have about 150,000 babies born every year with STC. It is something that we need to
alarming.
really raise awareness about.
And one thing we need to avoid is stigmatization. You know, when certain things happen that is beyond medicine, people are unable to explain it in details. They'll begin to allocate it to certain myths, and you know, they begin to stigmatize those people. That's why we are here to tell you, when you see someone that is having this, they need care. You don't need to stigmatize them. They are not second class or third class citizens. And you know, these people are actually going through a lot. It's not a very suitable experience. So
Not at all.
as many support that you can provide will go a long way. There are a few treatments that can be provided, some to suppress the pain, some to prevent
Pain
organ
relief,
failure.
antibiotics.
Yeah, like some antibiotics,
Hydroxyurea.
like you know, some of those things are actually given to them to help suppress the pain. So one thing you need to do if you are not on the sickle cell spectrum is to ensure that you give them support and that you are not stigmatizing them.
That's very important and profound. Ensure that you stay compassionate and show the appropriate love and care to individuals that are down with sickle cell disease around you. And another major role you can play is by ensuring that you educate individuals around you, because we have some individuals, like I used to wonder how that's in the times of old. We used to have the term in local parlance, abiku, like individuals just die, babies just die, but they do not know the reason why.
Yeah.
But bringing in now, we know that some of the reasons why these babies died then was because of the sickle cell disease. So one thing you can do is educate, get to know your genotype, get tested, educate individuals around you to know their genotype, and save that child from that pain. Because many a times, the pain is usually very severe, and the crisis is something that cannot be defined or explained.
So as we wrap up today's episode of Health 360, looking at sickle cell anemia, it is very important that we appreciate every single one out there, those who are who have the sickle cell, and their families, their friends, supporters, even the health practitioner. We appreciate you. We see what you are doing, and we want to say thank you.
Thank you. Whether you're directly affected by sickle cell disease or you have an individual around you that is affected, remember that every effort counts. It is either you're raising awareness or you're also helping to share information. Stay compassionate, stay healthy, and stay informed. Thank you for joining us on today's episode of L360. I am Blessing Oduni.
I am Solomon Ededo.